not just the top 25 industrialized countries. They just passed a law recently in Ghana, a poor African country, because they want it written into their laws that it is a human right, that if you get sick, you have a right to see a doctor and not have to worry about paying for it. If Ghana can do it, we can do it in the United States of America. Is that right? Is that right?
I'm here because we're trying to promote universal health care, and it's really important for everyone to be covered. As a nurse, we see a lot of people in the hospital who don't have coverage. They're here repeatedly, and people are really sick, so it's really important to get the word out.
Well, I'll tell you why it's important to be here today, because we got the whole entire middle class of California being disenfranchised from health care. We're tired of it, and it's time that we all step out and do something about it. So we're here to support Senator Sheila Kuehl in SB 840.
I've been a nurse for 30 years, and I think it's a God-given right for everybody to get free medical, whether you have a job or not.
We need to have universal health care. We need to have hospitals as nonprofit. And we also need to make sure that we regulate the drug industries.
I don't think you should be questioned at your insurance or what you have or what you don't have when you come in the door of the hospital.
Many people are being forced into bankruptcy because they can't afford typical health care. And I see every day through my wife's work cases that she works with and people that are either in severe health situations or cannot afford to continue their medical care or their prescriptions. And I think that it's time to change that by virtue of going through the health bills that are proposed before us.
There's no room for the concept of profit when it comes to taking care of people when they're sick.
That's right.
That question of how will this affect our bottom line? How will this affect our profits? That is an immoral question, and it should never be asked.
I had a friend of mine who was in a car accident who insurance did not cover their ambulance drive because it was not pre-approved. So how do you get pre-approval for an unforeseen accident? And then so she had to pay for the ambulance by herself, which was thousands of dollars. Does that make sense to you?
I think healthcare is being corporatized, and the big business is raping the system.
I took care of a patient that was denied an MRI for 2 years, is now dying of a brain tumor that his family and doctor were insisting for 2 years. He had health insurance.
And still was denied care.
And still was denied care that his doctor deemed necessary because the company didn't want to, the healthcare company didn't want to pay for it.
The top echelon, the CEOs and the people at the very top are making millions of dollars, while the people who are paying the premiums can't get the care that they need, often in a timely way.
Chicago. I walked all the way from Chicago to here.
Well, so we need single payer.
We've seen too much. We've seen too many people hurt by this. How can profit get in the middle of human life?
Because we're bringing it to Texas ourselves.
I am tired of patients coming into my clinic who cannot afford to pay for their prescriptions, so they come in hoping that I can give them a starter pack. I'm tired of patients not being able to afford their own dressings for wound care. I had a patient come in who'd been a Kaiser member for years, had lost it, but was really, really sick and waited until she couldn't get around anymore. Her husband brought her in and we did the best we could and had to have her go to county. I mean, this is getting ridiculous. People who have health care coverage are not able to pay for certain aspects of their health care, like their prescriptions and just anything ancillary to their care. I mean, it's not reasonable.
I want everybody to have equal access to health care. Yes, regardless of their social status, rich or poor, everyone should have the same health care.
No matter how sick they are, but they deserve to have health care.
Everybody needs health care.
Thank you for being here. Thank you for the work you do. And let's win this fight. Let's win this fight. Let's win this fight. Let's win this fight. Let's win this fight.